Welcome to The Point, a podcast by Apex Benefits and dedicated to employee benefits thought leadership. You can find more episodes for free on iTunes by searching The Point or Apex Benefits. Please rate, review, and subscribe to be the first to know about what we have in store for you. To learn more about Apex Benefits, please visit our website at www.apexbg.com or find us on LinkedIn, Facebook, or Twitter. Let's get to the point together.
What is pharmacogenomics? Welcome to the Point podcast. My name is Erin Albert. I'm Kinetiq Health Pharmacy Benefits Practice Leader here at Apex, and I'm a pharmacist. Today we're going to have a conversation about a brand new line of coverage that is now affordable and provides positive patient outcomes, which is pharmacogenomics. But what exactly is that? How do you get tested for it? And how can you apply the test results to optimize patient therapy? And why would employers want to cover this? We searched through all of those questions today with Dr. Daniel Wilson, who is a clinical pharmacist at TrueRx, which is one of our several PBM partners here at Apex Benefits. So give a listen to my conversation with Daniel Wilson of TrueRx. All right, we're here today with Dr. Daniel Wilson of TrueRx, one of our many PBM partners here at Apex Benefits. Welcome to the show.
Thank you for having me.
Pharmacogenomics, and both of us, I think, are equally excited to be sharing this with you today because it's actually a brand new line of coverage for our client. Before we walk into pharmacogenomics, Daniel, let's start with, first of all, who you are. Can you introduce yourself to our audience and what your background is?
Sure. I am a pharmacist. I have had several practice experiences before coming to TrueRx Health Strategist as Director of Clinical Operations. Played a residency with IU Health in Bloomington, Indiana. I've been in the emergency room setting. I've been in the inpatient setting. I've been in ambulatory care right alongside the doctors in outpatient care. I've been at the pharmacy counter dispensing medications. So bringing all that together to the managed care setting, I've really enjoyed being able to develop clinical services that can meet the patients where they're at, help them get healthier.
Awesome. And thank you for that background and that setup, because I think that's an important framework for the conversation about what truly pharmacogenomics is. It's a mouthful. So Daniel, let's break down at a very simple kind of high level, what exactly is pharmacogenomics?
Yeah, you're right. It is a big word, but simply pharmaco is drugs, genomics, genes. So when we break that down, it is how does the differences between person to person genetically impact how we respond to medications? We know that there are differences from person to person. We can see that, but that also includes how we process different medications. What does that mean? Well, that means that different people taking the same medication might respond differently. Some people might have extra side effects. Some people might do just fine, and some people may get no benefit at all just because of those genetic differences.
Excellent. That's a great starting point. So we talk in the world of how drugs move through the body, and that's pharmacokinetics, about absorption, distribution, and metabolism, excretion, those four kind of buckets. Talk a little bit, take that down a notch, and let's talk about how genes play into pharmacokinetics, or the ability for those drugs to work or not work in a human body.
Yeah, so our bodies get rid of different medications in different ways. Not all medications are sensitive to pharmacogenomics, but many are. That metabolism piece that you mentioned, how we take medications and break them apart. We take medications every day because our bodies get rid of them. And so when we break down those medications more slowly than expected, that means that those medications build up in our bodies, and that can be extra side effects, sometimes some toxic effects that go on. On the flip side, if you're breaking down those medications much more quickly than expected, then you may be just taking a placebo because you're not getting any benefit from taking that medication, even if you're taking it every day, just like you should.
I think that's an important point. Are the drugs actually moving through your body at a normal rate, at a fast rate, at a slow rate? And if it's accumulating in your body, you get more side effects. If it's going through your body faster, you're not getting therapeutic effects. So you can have drugs that are kind of falling in both categories relative to pharmacogenomics and your genes and those differences. So thanks for sharing that. Why don't we talk a little bit about which types of drugs? You mentioned not all drugs are altered by your genetic profile, but let's talk about the drugs that are.
Yeah, many are. And there are several categories. The main ones that we think of with pharmacogenomics, number one that always is top of mind is mental health. Many mental health medications are sensitive to pharmacogenomics. And goodness, in today's world, we all know that that's a big issue, a priority. Outside of mental health, we think of heart health, like blood pressure, medications for congestive heart failure, medications for cholesterol, making sure that cholesterol is managed well without giving unnecessary side effects. Pain management would be the other one. Both opioid and non-opioid pain medications are sensitive to pharmacogenomics. There are several others like transplant drugs and overactive bladder. There are a lot of different categories, but mental health, heart health, pain management are some of the primary examples of the types of patients that we could help with pharmacogenomics.
Those are three categories alone that are very common. A lot of patients are taking those medications, so you definitely want them to work. Let's talk a little bit about why pharmacogenomics is happening now and why employers might want to consider this as a line of coverage moving forward. The genome has been mapped now for several years, right? You get like 23andMe and Ancestry.com where you can get your whole genome mapped. But why is pharmacogenomics now more accessible for employers than ever?
Yeah, pharmacogenomics has been studied seriously since the 50s. That's a while ago. And yet, just now we're talking about this. Why is that? If in the 50s they were saying that genetic differences impact how we respond to medications, why are we talking about it in 2021? Well, the main reason for that is it's becoming practical. Even 10 years ago when I was in pharmacy school, it was a great idea, a way to help people, but it wasn't practical. Why? Primarily cost. Pharmacogenomics has gotten to be much more affordable as we have streamlined. Labs are able to turn around these results fairly effectively without a high price tag if you do it the right way. So as it becomes more affordable, we can move from the mindset of using it as a last ditch effort after we've guessed wrong several times to now being more proactive to get people healthy on the right medications to begin with.
Let's take a specific example. Let's talk about depression because there's mental health is a huge issue during COVID-19, definitely, but there's several antidepressants out there. And you mentioned mental health drugs are one of those categories of drugs that can be optimized through pharmacogenomics. So can you walk us through an example maybe of how physicians prescribe today, and then if they had a patient that had a pharmacogenomics profile, how they would use that information to potentially optimize therapy and get the patient well faster?
Absolutely. Traditionally, we guess. We have several great antidepressants that work well for many people. And so we pick one and see if it works. The problem with that is because of common differences in our genetic profiles, we know that not everyone's going to respond to the same medication the same way. A study about 15 years ago showed that it can take 3 or 4 tries to get people on the right antidepressant many times. There's about a 50-50 shot each time you try of whether it's even going to work. And so considering that many antidepressants can take 6 to 8 weeks to be fully effective anyway, we're talking 2 months delay only to find out it didn't work. That wasn't the right one, to guess again and maybe try to guess again in 2 more months because that one didn't work either. We're doing a lot of repeat doctor's visits. Something like depression that can be very difficult to get up the urge to fight. And yet you're guessing and wasting months to get on the right treatment. Why not get ahead of that, get the test done and find out what are the medications that are going to work best for me to begin with?
So not only is it driving up potentially the cost of visits and healthcare itself to the plan, but then you have the flip issue of the patient may be so debilitated that he or she is calling in sick to work and missing work days too, on top of it. So I think,
Absolutely.
yeah, those two items in and of themselves, I think, validate employers being able to potentially look at pharmacogenomics as a separate line of coverage. Can you talk a little bit about why pharmacogenomics is a completely separate line of coverage from the medical benefit or the pharmacy benefit?
Yeah. There's two main reasons. Primarily cost. If we look at pharmacogenomics as a covered benefit under the medical plan, it's not necessarily wrong. It's not that you're getting bad results, but the cost value isn't quite there. It can still cost several $1,000s for a pharmacogenomics test as a covered benefit. On the other hand, having it separate as a health enhancing service to provide to your members, you can have a much more competitive price. Rather than thousands, we're talking hundreds. And so bringing down that cost allows you to help more people for the same price. The other aspect is that you want to make sure that those results turn into benefit. The covered test on the medical benefit produces good results from a lab standpoint. But how do you make sure that that turns into clinical outcomes? And that's the reason we've designed our service to pair not only a quality lab, also with clinical consultation, that each patient that is tested is set up with consultation with a genomic certified pharmacist to understand what those results mean. What are their medication options? And then we can also provide recommendation to the provider that is simple and actionable that can turn into clinical outcomes.
From a pragmatic point of view, is the whole human genome mapped per patient under pharmacogenomics testing with TrueRx, or is it just parts of the human genome?
We have no interest in testing the 30,000 plus genes. I tell people we're not going to know where your ancestors came from. That's not the goal. We're testing about 20 to 30 genes that impact how we process medications. The rest really aren't of interest for the purpose of pharmacogenomics.
I went through the testing myself. And what I really appreciated about it was three different parts. Number one, you get a really cool kind of top level PDF summary of the major categories of drugs and kind of a red light, green light, yellow light approach to which drugs are best for you based upon your gene profile. The second part that I really appreciated was the consult with a clinical pharmacist who is certified in genomics, who walks you through actionable ways to utilize that report. And then can you talk about the third portion, the online portal? Because this is not just a flat report that you get and hand it over to you. Talk a little bit about how patients could use that when they're interacting with their physicians.
Yeah, once you've been tested through True Genomics, you get access to an online portal. The neat thing of it is you can search medications against your genetic results to see what is likely going to work well for you and what may not. When you find a medication that's not going to work well for you, there are alternatives that populate that can show you what other similar medications should you be talking to your doctor about. That allows you to be, as a patient, equipped to have a conversation with your doctor to say, hey, I'm showing that maybe genetically this isn't the right choice, but what about these other options? And you can have that discussion right there in the doctor's office without having to even start a medication that may not work well for you.
Yeah, and from my understanding, and correct me if I'm wrong, that database is constantly being updated by the organizations that look at these medications as they come out and whether or not they interact with gene profiling.
Absolutely. It is up to date with most current clinical research. CPIC, PharmGKB, these are the organizations that organize the research when it comes to pharmacogenomics. So we're getting the most up-to-date evidence-based medicine on a personalized level.
Daniel, let's talk about who would be qualified for this type of testing. Obviously, it's still several $100s. It's not thousands of dollars anymore, which is a great thing. But let's talk about who might qualify for pharmacogenomics testing. Let's break that down a little bit.
Right. So looking at claims data, we can identify very easily who is taking medications that are sensitive to pharmacogenomics and therefore may not be getting the best benefit because of their genetic differences. So we can reach out to those individuals to get them set up for testing to make sure that they're on the right treatments. And we also have a pharmacogenomics hotline that if a patient is in a client who offers this service for their members and they're contemplating maybe one of these medications, they know that maybe I need to go to the doctor for antidepressant, but I've heard about pharmacogenomics. Well, we do have a hotline to have a discussion with a pharmacist that they can, we can talk that out and see, yeah, this could be beneficial for you from a proactive standpoint, or maybe that wouldn't be quite as beneficial. We can have that discussion as patients inquire.
Daniel, I mentioned 23andMe and Ancestry.com. If you've already got those test results, I guess maybe two-part question. Number one, how are those results different from a pharmacogenomics test? And then secondly, are they as accurate as a pharmacogenomics test, specifically looking at the genes that affect drug metabolism?
There are a lot of different direct-to-consumer tests that you can go online and order, and they test different things, whether it's Ancestry or whether you like the taste of cilantro or a lot of different things. And some of them also offer a pharmacogenomics component. My caution there is making sure that the test is one of high quality. There have been some cases where the FDA has said, okay, you can do that test. That's great if you want to, but if there's a result that comes back not normal, make sure you do a medical grade test to confirm it. My question there is, why bother with step one? Why not go straight to the medical grade test? Make sure that you're getting quality results, because you want to make sure that if you're going to change medications, that you're doing it based off of good information. And the other component is the privacy. When you're dealing with a medical grade test, that's protected under HIPAA and GINA, and so there is more security versus depending on which direct-to-consumer service you might use, read the fine print as far as where your genetic information could go.
So, Daniel, let's talk about the test itself for pharmacogenomics. What do you have to do in order to get your pharmacogenomic profile?
It's a simple process for the patient. Once we confirm that, the patient's interested in it and wants to get the value of the pharmacogenomics test, we send them a test kit right to their door. And that test kit is simply a self-administered cheek swab. It is not a blood test. You don't have to go anywhere to get it. It's not something you have to stick up your nose. It is just a cheek swab you rub back and forth and stick it in a prepaid envelope, drop in your own mailbox, and then it goes off to the lab.
How long does it take to get the results on average?
Yeah, typically we see the results back within 2 weeks.
And then the patient has outreach to do the consult with the pharmacogenomics pharmacist?
Yeah. Once we get those results, we reach out to the patient to let them know, hey, your results are in. Let's set up a time to talk about it. And so at that point, we can go over what those results mean with the patient and what their medication options are.
Can you maybe share one other story with our audience about the value of pharmacogenomic testing, and maybe a story that you've heard about how it impacts a patient's therapy and a positive outcome?
Yeah, I'll share a couple if you don't mind. I think of one of our own coworkers who was tested for pharmacogenomics. She had a significant heart history in her family where many family members had heart attacks at a young age. Her cholesterol was high, and despite trying several medications, she wasn't able to withstand the side effects. And so she just kind of gave up and accepted that was her fate. When we got her tested and we found a medication that would work for her, that now she is on a treatment that is managing her cholesterol and her risk factor is being controlled. Sitting across the desk from her while I explained this, just seeing the relief in her face as realizing I can do something about this now. Not all cases are quite that dramatic. Sometimes it's just a matter of confirming that, hey, we're on the right path. I think about a mother that had a couple of children with ADHD, and it had been kind of a struggle to get to the point of seeking out treatment for them. And they got tested and found, yeah, we're on the right path. And the feedback from the mother was, after all that we've been through so far, knowing that we're on the right path, it just puts me so much more at ease.
Love those. Yeah, I think those real world stories about the impact and what positive outcomes can be achieved around these testing opportunities, I think, are huge. In closing, Daniel, where can people learn more about pharmacogenomics and TrueRx and their services around this line of coverage?
Yeah, for True Genomics, we have a lot of great information on our website at truerx.com/pgx. And I also know the Point Podcast with Apex has several conversations around pharmacogenomics, so definitely return to the podcast.
Well, with that, Dr. Daniel Wilson, thank you so much for sharing your insights on this exciting line of coverage that we finally have some access to.
Well, thank you very much.
You can find more episodes for free on iTunes by searching The Point or Apex Benefits. Please rate, review, and subscribe to be the first to know about what we have in store for you. To learn more about Apex benefits, please visit our website at www.apexbg.com or find us on LinkedIn, Facebook, or Twitter. Let's get to the point together.